Hello, my name is Mary Muse, and I will be talking to you today about ECT, other really known as electroconvulsive therapy or shock therapy. I actually was inspired by another girl on YouTube who did a fact versus myth episode on ECT. And so I want to give credit to her. I'll add her link to her video in the bottom of my comments. And yeah, I wanted to go over the facts and myths because everyone has their own different experience. Some people have better, some people have worse. I wanted to share my history and experience with it and what I'm doing now. So I'm first going to give you just kind of like the history and how ECT works, and then go through the facts and the myths, and then in between all that, I'm going to interweave my personal experience, and I even have pictures. So stay tuned. Okay, so the history of ECT. Back in the 1500s, a guy with a very long Latin name, but his middle name was like Philippius, so I'm going to call him Philip. Back in the 1500s, Philip, well, first off, the reason that we even try and do ECT creates a seizure within the brain. They realized back like in the 1500s and even prior to that, I think it was actually Philip who discovered it, that people who have schizophrenia do not have epilepsy, and people who are epileptic don't have schizophrenia. Pardon me, I have a kitty on the table. And so they decided, well, hey, what if we give some schizophrenics some seizures and see what happens? And lo and behold, the ones that were in catatonic states, or who were in acute, not chronic states of schizophrenia, their symptoms were resolved. And so it was kind of like the miracle cure. Oh my God, we create seizures in these schizophrenics, and then they get better, or they get functional, or wake up. It's sort of like rebooting your computer. Remember the old like Mac and Windows computers, and you have to like reboot, and the internet connection. I'm dating myself right now. Then they realized later on in 1785 that they can also use it for mania in people with bipolar disorder. They didn't know or have a diagnosis for bipolar people. They just categorized everyone that was in a manic state as crazy, and so they would zap them. And I mean, it was really barbaric back then. They used camphor, which just creates a seizure, and they had no pain relievers, they had no muscle relaxants, and so they would chronically have fractured bones and dislocations and stuff. It was truly barbaric. In 1938, an Italian man by the name of Lucio Bini did the first electrical impulse of creating seizures, because after camphor, what we used was either insulin shock therapy, or we used frontal lobotomy. And so they figured, hey, you know what? If shocking them works better than, and the insulin shock therapy, you can actually see what that looks like in a pretty good representation if you watch the movie A Beautiful Minds. With Russell Crowe. They show him having full-on seizures and having the tongue depressor into the mouth, and how, I mean, if you've never had seizures before, it is so exhausting. And forget about dislocations and fractures. It is just exhausting. Your whole body is just, every muscle is tense. It's like doing a crunch, but your entire body, every muscle in your jaw, every fingertip is doing a crunch all at the same time for, at that point in time, minutes. And they didn't really regulate on how much electricity was being pumped through. They didn't know like what thresholds people needed. And so back then it was really barbaric. Helpful, but really horrible. It was at that point in time a last case kind of situation. In 1934, a man named Joseph used an intramuscular injection of camphor for schizophrenia, catatonia. And it wasn't until 1938, I told you, that Italian Lucio Benini did the first electrical impulse. By 1940, it was finally brought into the United States, and we started using it here. And it wasn't until 1941 that they decided, hey, why not give these kids some muscle relaxants to make their seizures a little less like strenuous? Because even when you're strapped down in these gurneys, like you can still, oh, it's horrible. So yeah, they use generally they use methoxidil, which is a barbiturate for anesthesia, and nowadays, for me at least, they didn't use any muscle relaxants. What they used was a depolarization drug that I can't pronounce, and it incites a state of paralysis. And what happens is they would get my IV going and get just fluids going in me. I would be wheeled into the, it's not really an operating room, the procedure room, because it's not invasive. And then I would joke around with the nurses. They would play my favorite music that I wanted to listen to, usually country or rock and roll, while they're getting everything set up. They would still strap me down just for liability's sake in case for some reason the paralysis drug didn't work. They just for liability purposes, so I wouldn't injure myself or them. But they would put a compressor cuff on my leg, my right leg, the leg that they didn't have the IV in, because I was so anorexic at that point. They had a hard time finding my veins, and so it depended on where they could find a vein, they would put the cuff on the opposing leg. And they would make it really, really, really tight, and then they would put me to sleep, and the second they put me to sleep, they automatically gave me that injection of paralysis, and it was full paralysis. I would stop breathing. The anesthesiologist had to breathe for me and pump air into my lungs to make my diaphragm expand and contract. And they did that so that way my body wouldn't convulse. And so they would have all these electrodes all over me, all over my chest, all over my arms, all over my head. They would put this nasty conductive goo in my hair. At first I did it unilaterally, which is when they only do it on one side of your head. And I had 3 series of this, and I'll get into this in a second. But on the second and third series, because it didn't work for me, they did it bilaterally, which means I did it on 2 parts of my head, shocking me. So they would induce the seizure. They were looking for a 15-second period of having a seizure for my major depressive disorder, from bipolar disorder. And it was actually, I never saw it obviously, but it sounded pretty cool. They would administer the electrical impulse, and they could see my brain waves on their scanner to be able to tell if I'm reaching the maximum threshold, and I'll get into that in a second. And then they would also confirm, because my leg that had the compressor on it didn't get the the paralysis medication into it, and so my leg would start twitching, my foot would start twitching violently, only my leg, and then they're like, okay, we got 15 seconds, we're good, let's take this shit off, let's get her out of here. The amount of electricity that they put through a person's brain in the United States is measured in millicoulombs. And they do it by empirical titration, which means that they start off at the lowest denominator and they work their way up, shock more, shock more, shock more, shock more, until they can establish a period where they can get that 15 seconds of seizure. And then from that point on, they know for your next series that you have, they can start at that level. So generally, it's within anywhere from 25 to 1,000 millicoulombs. But in the United States, where they allow, or the FDA permits, 403.2 to 504 millicoulombs. That equals out to 240 or 450 volts. That's a lot of voltage, and at 0.8 or 0.9 amps. So if you were to put those things across your chest, it would kill you in a second. But we put them through our brains. Hey, it works for most people, hey? Okay, so now that you know the kind of history and how it works, just an interesting fact, the states are not required to report how many people, how many patients undergo ECT each year, but it's estimated around 100,000 each year. So facts or myths, and again, this is compliments of the girl that I saw online, which I will tag at the bottom of my comments. Facts or myths. ECT causes seizures. As I just explained, that's the whole point of it. And again, it's either unilateral or bilateral. ECT is only for depression. Myth. ECT was originally, like I said, for schizophrenia, for catatonics. It's also for mania in bipolar, and it's for major depressive people who are suicidal. And specifically for me, I was suicidal, and I'm also drug resistant. I do great with mood stabilizers. I do great with benzodiazepines. I do great with Adderall. All of that's fine. Antidepressants, SSRIs, SNRIs, they don't do a thing for me, or they do and then they like stop after 3 weeks. So I was considered RX resistant. Occasionally they do it for acute schizophrenia and only rapid onset schizophrenia. So fact or myth, ECT is only done in mental hospitals. Myth. In my experience also, it's an inpatient or outpatient for maintenance. Usually you have between 6 to 12 treatments, usually 2 to 3 times a week. I was every Monday, Wednesday, and Friday. And you do this for 2 to 4 weeks. So I had Monday, Wednesday, Friday for 4 freaking weeks. And then it went down to once a week for, I think, 4 weeks. And then it went down to every other week for the remainder of the year. And I did this 3 times. Yeah. So, and that was done at, if you're local to California in the Bay Area, that was done at El Camino Hospital. And I was in the mental ward when we decided to go with the ECT route. And they also wanted me to be in there, regardless if I had been in there or not. They wanted me in there so they could just monitor me, make sure I'm taking the exact meds at the right times, just reduce any variables that could have possibly occurred. Fact or myth, it is dangerous. This one, hello kitty. My kitty wants to come say hi. Fact or myth, it's dangerous. They say there's only 2.9 deaths per 10,000 patients. And that's good, but I mean, you're going through surgery. So surgery itself is going to be, you're going under anesthesia. You're having paralysis or muscle relaxants pumped into you. You're getting electricity shock through your brain. It's any type of surgery, even if you're getting a hemorrhoid removed and they put you under, that's dangerous. So they say it's a myth, but no. And also they really don't know why seizures like resolve these issues. They use the reboot your computer like metaphor, but they don't know how it works. They don't know why it works. We just use it because it's been grandfathered into our medical society. And they don't really have any biomarkers that they use. They don't know exactly where they know exactly like which lobe they want to do it. If they want to do it unilaterally, they know precisely. Yeah, it's kind of like right above your temples. Yeah, just kind of north of your temples a little bit. Yeah, that's where I felt the goo afterwards, at least. Yeah, and I don't know until they do the marker of how much electricity to use. Go on, kitty. And it affects, while it's local, and while they try and centralize the effects of the electricity, every single neurotransmitter in your brain, every synapse in your brain gets a reverberating effect of the electricity going through you. So it's nothing to take lightly, is all I'm trying to say. Fact or fiction, it doesn't work. Definitely fiction. There is an 85% full recovery within, and people feel it within days to weeks. I personally did very well with ECT at first. It was hard. Like, let me show you some examples. I'm an artist, and so as you can see from like the back wall and everything, and this is one of the pictures that I would draw. They were kind of morbid and very depressing. Here, let me show you. I have a couple to show you. Here's another one. And this is the stuff that I would draw before ECT. These are all pictures of paintings that I've done. And last one. So, and then when I was done with ECT, I'm going to show you this and I'm going to read you what I wrote for it. This is called The Gift. Okay? I can remember, maybe halfway through my ECT series, walking around the lake near my apartment in San Francisco. It was an unusually warm day. There were people riding their bikes, and there were butterflies fluttering in the blackberry bushes. I can remember, in a detailed and impactful memory, how that was the first time that I had ever felt the sun. I could feel the rays tickling my skin on the back of my shoulders. I could feel the light warming my chilled bones from the inside out. For the first time in 25 years, I was overcome with an intense feeling of contentedness with everything around me. The bicyclists, the butterflies, the berries, in their simplicity, they made me smile in a way I had never done so before. I feel that way every day now, but that moment was the first, and what I wanted to share with my doctor. She gave me the gift of experiencing life through ECT. The least I could do is paint her a tangible illustration. But how can you make the sensation of the sun concrete? How can you capture its tickling on canvas? This was my best attempt. It's a figure dancing in pure ecstasy at the sun's glow as spirals of beams come toward you, hypnotizing you with their solar beads to warm your chest. This was a bit out of my realm of style. I'm generally more comfortable with my surrealism and sharp lines. Trying to make the spirals and beams look soft as light was difficult to do. I hope she likes it. Maybe someday it'll be worth something. If not, it's at least a gift of my appreciation for the gift she gave me. And that was not in any mania. That was genuine, just pure joy and just happiness. But it went away. And so we tried it again. And it went away, and we tried it again, and it went away. And at that point, I had negative side effects that I can describe in a second here, but it just wasn't worth it to me anymore. So, so I'm one of the weird 15% that it didn't work for. So, fact or fiction? It causes memory loss. Fact, mother effing fact, does it cause memory loss? They say short-term confusion and it ends when the treatment is done. Bull crap. Try waking up in a bed in a gurney, realizing you're in a gurney, looking around, oh, I'm in a hospital. You have no sense of identity. You recognize nice nurses, so you're wondering if there is a terrorist attack or something, and you're like waking up with amnesia. And they're taking care of you, and so you feel calm and safe. You're not scared, but it's just confusing as hell. And then a woman is ushered in, and they say, Mary, are you ready to go home with your mom? And I look at this foreign woman. That's not my mom. What does my mom look like? Who is my mom? And then a gentleman comes over and starts kissing me on the forehead. Hey, baby, how are you feeling? Who the fuck are you? Mary, that's your fiance, says the woman who claims to be my mother. I had no idea who any of them were. Every Monday, Wednesday, and Friday, I had no clue that I had a puppy waiting for me at home. Every Monday, Wednesday, and Friday. And it was, the memory loss is horrible. I would go into the bathroom before, when I would get clothed. I would go into the bathroom and do my thing. And I would look in the mirror as I'm washing my hands. I wouldn't recognize my face. Do you know how terrifying that is to not know who you are inside and not visually recognize yourself? And then when I would get home, and I kept a journal and write everything down, like all my passwords to everything, because I knew I was going to forget them. And I would be reading it, and it was foreign script. I mean, I could read it, but I couldn't recognize the handwriting. It was absolutely mind-boggling. They say that it stops. So everything up until ECT, I remember clear as day, as well as anyone could for being like in my 20s, you know. Between the ages of 26 and 29, when I had ECT those 3 times, I don't remember one single thing. I have photographs because I became a photo conniption fit person, trying to record everything and to remember. And I would look at pictures and I wouldn't remember anything. And it did get better when I stopped having ECT, but it still affects me to this day. I will repeat stories over and over again to you because I don't remember that I told them to you. I have excellent short-term memory, but that transference from short-term to long-term is still dysfunctional. And so I have a hard time like going back to school. I can do great for cramming for tests, but actually learning the material into the deep memory doesn't happen very well. Not without a lot of effort. Okay, fact or fiction, it's used to punish patients. Myth, kind of. It was abused in some notorious institutions back in the day. It was used to kind of silence women who voiced their opinions too much. This was mostly during the 40s and 50s. Now you need complete and utter consent from both you and your family. You need to go through like a whole doctor, a panel to get approved for it. The court can mandate and state order you to do it in some states if you're out of control regarding mania. But other than that, it's not used to punish patients. Is it a permanent cure? Myth. For everyone, even the 85% that do well, myth. They need to do maintenance, which means every month or every other month they have to go back and get bink, zapped. And yeah, it's a lifelong commitment. A lifelong commitment. Fact or fiction, it's a last resort. It's not really a last resort because of the methodology. It's a last resort because of bureaucracy, to be quite honest with you. It's more expensive. Insurance doesn't want to pay for it. There are fewer machines. There are fewer people or surgeons who are licensed and capable of performing it. So it's just trying to find all those things, getting them lined up, that it becomes the last resort. When it's so much easier for your Dr. Joe Bob on the street to hand, like, here's some Zoloft, feel better. So yeah, it's only a last resort because of finances and bureaucracy. Even in fact, Dr. Stone, who's a clinical and forensic psych in Orange County, California, said that it is the safest and most rapid treatment. Okay, a little bit more for you. These are all myths. It is given to make people forget things. I wish. That would be so nice if I could forget some things of my past, but I remember everything up until the first day of ECT like it was the back of my hand. So it doesn't help with PTSD. It doesn't help with no. ECT is painful and horrifying. I would have huge anxiety attacks because of the whole, what I mentioned of not remembering people and not remembering things. That would just send me into anxiety. But the actual procedure itself is not horrifying at all. It was actually really sweet. Like I said, they played my favorite music. I got to know my anesthesiologist. I knew Dr. Taylor. It was really pleasant, and the nurses were so sweet. It was a really pleasant atmosphere. Just coming home was hell. And then the migraines. I get migraines to begin with, okay? Where I'm light sensitive, I'm nauseated, I'm audio sensitive. Like metaphorically speaking, when I get migraines, I want to like put a bullet to my head to make the pain go away, metaphorically, okay? With ECT migraines, I don't want to put a bullet to my head. I don't want oxygen near my head. I want to shave my head and get the hair off. I don't want anything touching my head because my whole head hurts so freaking bad. It's not even pulsating. It's just a constant pulse of intense pain, and they don't give you any pain medication besides Tylenol or like 800 milligrams of ibuprofen. And this would last 6 hours to a day. And so I would wake up, I'd do it Monday, I'd wake up on Tuesday and be kind of groggy, but I'd feel happy, but I'd be kind of sedated and tired, worn out. And then Wednesday I'd start it all over again. And then Thursday I'd recover. And then Friday I'd do it all over again. And I did that for months. So it is painful in that regard, definitely. Last one, myth or fiction, or fact or fiction. It causes brain damage, reduces IQ, and changes your personality. Well, it does not cause brain damage whatsoever. There's been no proven It doesn't do brain damage. You like that mental slip there when I'm trying to tell you it doesn't do brain damage. It doesn't reduce your IQ. I managed to pass Calc and Trig while I was doing this at San Francisco State. I don't remember a damn thing from those classes, but I passed them, so it didn't mess up my IQ. And it doesn't change your personality. It does change your personality. The whole reason you're having ECT is to either stop the mania, stop the depression, or stop the catatonia for most cases. And so you're obviously doing this to change. So of course you're going to have a personality change. You're not going to be Dr. Jekyll, Mr. Hyde, hopefully. Like, I've never heard of any case like that. I don't want to say it would never happen, but I've never heard of a case. But like my personality from those pictures, like I blossomed. I was happy. I was joyous. Like how you see me now. I was like that all the time. And yeah, I miss that. And that's where my notes end. And I just wanted to tell you, I am still suffering from depression. It's not suicidal or anything dangerous, but it is definitely interfering with my life big time. I haven't been able to work in weeks. I feel when I'm not like intensely engaged with something or a conversation or doing an art piece, I feel like I'm just in a cloud of just despair, and like my silver hair, just despair. And so what I'm going to be doing starting next week is called TMS. It's transcranial magnetic stimulation. And because I'm running on 26 minutes right now on this video, I will just add another link. It's a 30-minute video. Again, it's really long. And it describes the exact procedure I'm going to have by the exact machine, NeuroStar. And so if you're interested in about TMS, because that's completely non-invasive, I can drive myself there. It's a 37-minute sit down. They do like an MRI scan, and then I can drive home real easy. It's 5 days a week for 4 to 6 weeks. And yeah, you can learn more about that on that video. Just to warn you though, his voice is like the voiceover from your archaic sex ed videos, like, depression is so horrible. Like, it's really annoying to listen to, but he's got some really good information. And so on that, I hope I enlightened you guys to ECT and my experience. And yeah, I hope you all have a great Tuesday.